Here we are studying on chapter 11, which is reality therapy. Um, William Glasser and Webolding, Robert E. Webolding are the two theorists that are responsible for choice theory that influences reality therapy. So those are the key things that you need to know, a couple of key things you need to know for your final exam. And again, the final is only up on the second half of the book. You guys already had your midterms, so everything after midterm through the end will be on the finals. They're not cumulative, they're just half and half. So everything after midterm. So just keep that in mind. I don't want anybody panicking. So this great quote from Glasser says, "The seeds of almost all unhappiness are planted early in our lives when we begin to encounter people who have discovered not only what is right for them, but unfortunately what is right for us." So Glasser was really annoyed with he was super annoyed with psychoanalytic therapy. He was trained that way and did not think it worked really well. Of course, he was in a situation where he's a psychiatrist in a prison and school for girls. He thought it was of limited use. He thought it was a lot more productive to talk to the sane parts of the client and not the disturbed side. And he started to formulate his theory um, really with more educators and social workers and things of that nature. And then he wrote a groundbreaking book that you'll need to know called Schools Without Failure in 1968. It had a major impact on schools in the way that we train in schools and the way we do look at school. He helped us to look in our schools for more of what we call a success identity versus a failure identity. And those are really important terms to know as well. This is why it's important to listen to these lectures because those are going to be test questions for sure. So I make notes when I'm lecturing and then I put some of those things in the finals. So make sure that you are listening to these. That's the way that we make sure you learn it and that we are being ethical in our teaching and making sure you know this stuff because it's so important that you do know it. Okay, what else do I want you to know about that? Um, he was influenced by this control theory that eventually became choice theory. Control theory came from William Powers, and he spent 10 years after that really expanding it and changing it to choice theory. Um, the essence of reality therapy is now it is taught all over the world. I'm going to click on this link just to see if it works to make sure that when you guys are watching, you can copy and paste it into your browser and make sure it's not a dead link. Isn't I think it's so funny. I'm just 1 year that link will be gone. You know, it's crazy. I taught this last year and the links will be good, and then we go click on it and it's no good. Let's see what we got here on YouTube. Let's see if Glasser is going to come up. I know you can't hear it on your end. I am going to address that. Oh, look at that. Let's see. Something went wrong. Let's reload and see. Pause it so I'm not. The good news is I have a video that works. The link works to a look into reality theory and choice theory. So definitely take a look, take a peek at that and watch that video. That'll be really interesting for you to see. So let's go back to our slides. Here we go. There he is. And then we also have another important theorist, Rebolding. And he is responsible for the WDEP system, which is one of the interventions or ways to conceptualize in reality therapy. So you'll need to make sure that you know that and know Rebolding that he's responsible for that. He he's interesting. He started off as a Catholic priest, but left and subsequently got married. So he said, "The heck with that! I'm going to get married." Taught at Xavier, Johns Hopkins. He was trained by Glasser and has devoted his life to expanding this. 14 books, 150 articles, essays, and chapters, and is a devout religious man who apparently that comes through in his work. So Robert Webolding. So make sure you know both of those and you know that they are linked with this theory. So the theoretical principles that underlie this, the relationships with few clients, understanding their problems, which is unhappiness, results from their own behavior. So let's talk about what that means for a second. Reality therapists, what that means is that they think that there's probably something that brings you in for therapy is that you're having a problem with others. You're having a problem connecting in relationships. You're having unsatisfying relationships with someone in your life. And the goal is to help guide that client toward a more successful, effective relationship. I think this is probably true. I mean, a lot of times clients do guide to you hear Dr. Beal say this all the time, right? In my lectures. I feel like how I talk about myself like that. But, I say it seems to be there's something going on in their relationships. There's some kind of issue there. And so the concept of this is to help them to teach them more effective ways of interacting with people and having more successful relationships. They do not believe in diagnosis unless for insurance. What are your thoughts about that? I'm wondering what your thoughts about that are for diagnosis. I'm going to write a note so we can talk about that when we get back to class. That's question mark. No diagnosis. Glasser doesn't like that self-fulfilling prophecy and diagnosis. He thinks that's not a good thing to do. That we should reserve mental illness for things like Alzheimer's, epilepsy, head trauma, traumatic brain injury. People who have a brain abnormality, they should be treated by neurologists. He advises counselors to follow standard practice and standard of care regarding diagnosis and the use of psychiatric medications. That's Webolding. So Webolding's view is different than Glasser's view. So Webolding, he said something a little bit different than Glasser. He's a little bit further along than Glasser. I already talked about choice theory a bit when I first started discussing Glasser, but choice theory is the theoretical basis for reality therapy. So it's the backing of it. And it says that we're not blank slates waiting to be externally motivated by forces in the world around us. We are born with 5 genetically encoded needs that drive all of our lives. And that is a great test question. They like that on the NCE too. These 5 genetically encoded needs that drive our lives, which are survival, self-preservation, love and belongingness, power, which is your inner control, freedom, which is your independence, and fun, which is enjoyment. Those 5 things. So that's what choice theory posits, that we are not blank slates waiting to be externally motivated by forces in the world around us, that we are encoded with these 5 things. Choice theory is based on the premise that because we are by nature social creatures, we need to both receive and give love. We need to love and to belong. That's the primary need, to have those relationships be fulfilling. Our brain functions as our control system. It monitors our feelings to determine how well we're doing in life to satisfy those needs. We're often driven by pain and we try to figure out how to feel better. Reality therapists teach us choice theory. That is part of this theory, to teach your client about it. Oh, cool. I'm going to talk about that in a second. I was going to say I wanted to keep talking about the quality life and the quality world. So when we get back together, I want you to think about this and make sure to adequately prepare for everything in these classes. Make sure you listen to these. I try to make them short. Sometimes they're 30 minutes. Put them on in the car on your phone. Do something so that you can hear me talk about it and read it. It would be better if maybe you read it and then listen to it after, and then go back and study the terms and the key components of the theory. That will be how you can best solidify your knowledge. But how do you meet these areas of your life, these 5 genetically encoded needs? List what you're doing to meet those needs. And this is kind of like the balance wheel, right? So I'm going to put this down. You can do it at home, or we can do it when we get back together. I'm making some notes for class prep. Okay, so let's go on and talk more about choice theory. So what does choice theory teach us? That we do not satisfy our needs directly, that when we're born, And through our life, we continue to track everything in our mind and we store it up inside what we think is the absolute perfect quality life. What is our ideal life? We develop this inner picture album of wants and needs and ways that we think we need to satisfy those. And so our goal, and sometimes those are cloudy and sometimes they're clear. And our goal as a therapist is to uncover what is most important to them. We're going to prioritize their wants and uncover what is most important to them. And one of the really interesting things about this is it's really important. You have to be, as a therapist, a kind of person a client would put in their quality world. Because if not, they're not going to let you get close to them and let you know what they need or let you into that picture. So just FYI there. I think it's pretty easy to do when we use Rogers core conditions. Choice theory also talks about every total behavior is our best attempt to get what we want to satisfy our needs. Total behavior is defined as four inseparable distinct components: acting, thinking, feeling, and physiology that accompany our actions, thoughts, and feelings. Choice theory emphasizes thinking and acting, which makes this a general form of cognitive behavioral therapy. The primary emphasis is on what the client is doing and how the doing component influences the other aspects of the total behavior. Behavior is purposeful because it is designed to close the gap between what we want and what we perceive we are getting. So when you look at this, think about thinking, behaving, feeling, and physiology, that body component. Those are the different interacting parts that do in totality. That is our behavior, right? That is our total behavior, totally fully encompassing of us when you think about it that way. So from Glasser's perspective, also with behavior, he looks at those a little bit differently. He looks at those as parts of the total behavior. So having a headache, being angry, being depressed, being in pain, he uses those in a verb form. So you're depressing, you're headaching, you're angering, you're paining, you're anxietying. It's more accurate to think about people depressing or angering themselves rather than have the behaviors thrust upon them from the outside world. So if you have a client, you talk to them about this and you tell them that probably these behaviors are helping them get a need met, helping them to get something that they want. And it can often be off-putting to clients, but I tell you, there's some truth to this in that we talk about secondary gains. A lot of times, clients get used to being depressed or being angry, and they don't feel comfortable when they start to heal. And so, I do think there's some truth in this. However, I'm wondering what do you think when you explain this to your client, um, that they're choosing pain and suffering. The behavior of the person is the best effort, ineffective as it is, to satisfy needs. So if we're telling them that your depression is satisfying a need, I'm wondering what they would think about that. What do you think? Also, Waboulding said that behavior is a language. So what are we trying to communicate? What message do we want others to get about us? What are we trying to send out to the world? What is that? So more to consider there with choice theory. I'm going to make sure I didn't skip ahead here. Okay. Oh, I did. I often do that, don't I? Skip ahead. But the behavior is a language to communicate to the world. What message are you sending to the world as a result of your actions? What message do you want other people to get about you? And what messages are they getting? Whether you intend to send them or not, because often messages are sent unintentionally, right? Sometimes we think we're sending a message, but it's the wrong message, or a message we didn't intend to send. So here are a few characteristics of reality therapy. It is all about choice and responsibility. Remember back with existentialism, which is freedom and responsibility. This is really focused on choice. I really want you to think about choice theory. And that will be a term that could help you to connect it with the test question. So we're going to kind of take each one of these and talk about each one. But before I do that, I want you to really focus in on the first paragraph in the characteristics of reality therapy on page 316 in the middle of the page. And I want you to really look at this sentence. It says choice theory teaches that talking about what we cannot control, what the client cannot control, is of minimal value. The emphasis is on what the client can control, so choice. The basic axiom of choice theory, which is crucial for clients to understand, the only person you can control is you. Reality therapists, if you're going to do this theory, you're not going to listen to complaining and blaming and criticizing and all that. There's ineffective. What can we do to help the person? I often do this a lot with EMDR. I cannot help anyone other than the client. Everyone else is out of my room. They're not there. We can't control other people. And we have a choice on whether or not we are going to respond and how we are going to respond to those people in our world, our quality world, and a picture album, if you will, for this theory. So just some key things to kind of stick out there for you. Write little note cards, little things I'm saying here in this PowerPoint that stand out to help you know how this is different than the other theories. I'm trying to give you little hints to help you stay focused and stay on track. So let's talk about each part of this. So let's talk about emphasizing choice and responsibility. If you are a therapist in this theory, you're going to emphasize to your client that they are responsible for themselves. They have a choice. They have a choice to do something about what is happening, as if they are supposed to act as if they have choices. We've already covered that talking about what clients cannot control is of limited value. That's not something that's going to come in the room of a reality therapist, and they totally reject transference. They don't lend themselves to transfer. Glasser says that transference is a way that both the therapist and the client avoid being who they are and owning what they're doing right now. It's unrealistic for therapists to go along with the idea that they are anyone but themselves. In a situation like that, this is what he would do. I am not your mother, father, or anyone but myself. This is Will Bolding states that he discusses this issue with the clients in a detailed manner. Wow, let's write that down to discuss when we come back together. Let's see. I'm just curious what you guys think about that. I find it interesting. For me, I find it somewhat troublesome, just because I know about the brain trigger. And so if we are hijacked by the limbic area in our brain, when we're triggered by certain cues in our environments, and we're classically conditioned to start panting, if you will, from behaviorism, then couldn't we be transferring something? Now, I feel like the way he is dealing with it, but he's saying, no, wake up. No, I'm not that person. That could also be healing in other ways. That could be cognitive behavioral therapy and with parts work, if you think about it that way. So I get why it works, but it's always interesting when you see something that strong of an argument. They are present focused, present, present, present. So we have past, present. This one's very present oriented. They not so much about revisiting the past at all. The reality therapist will let the client talk about the past a little bit, but they won't stay focused on it. It's not the focus. That's over. We're moving forward. What can we do about that now? How are we going to focus moving forward? It can't be changed. It's not that the therapist wouldn't listen, but then they would try to move them forward. It can be changed. It's over. So also they don't focus on symptoms. Reality therapists really think that focusing on the past protects the clients from facing the reality of unsatisfying present relationships. The same with the symptoms. When you focus on the symptoms, you don't really have to focus on the core of what's going on. They're reluctant to accept the reality that their suffering is due to the total behavior they are choosing. So this theory says you're choosing to be depressed, you're choosing to be anxious. They don't talk about the symptoms at all. That's the last thing they talk about. And now it's probably controversial what you guys think about this, but I know that it is, but I do say as EMDR therapist, I go back and process the events and I don't spend a ton of time on the symptoms because my theory is that if we go back and recondition that brain, right? If we're going back and we're changing all the cues and we're desensitizing every memory so that you're no longer triggered and affected mind, body, and spirit and emotion, then why would I waste your time talking about your symptoms when your symptoms will probably dissipate through the way that I'm going to do my work with you? So, interestingly enough, I do lend myself to this a bit, and I wonder what you think. This is what I miss about teaching PowerPoint in class, being able to talk to you right away. Um, Reality therapy also really challenges the traditional views of mental illness, and really they think everything comes down to unhappy relationships. Focusing on the present and relational issues, then you can help to heal the issue. We talked about traditional mental illnesses, that choice theory rejects the notion that people with problematic physical and psychological symptoms are mentally ill. Webolding takes a firm stand on using the DSM-5 in creative ways and adhering to standard practice. Glasser, however, had warned people to be cautious of psychiatry. It can be hazardous to both one's physical and mental health. And you remember, he has a history in psychiatry. I find that interesting. He criticizes the traditional psychiatric establishment for relying on DSM-5. So Glasser is really anti-DSM, but Webolding is saying he can work within that framework, that model, and he still use reality therapy by reframing diagnostic categories and negative behaviors, helps the clients to perceive their behaviors in a different light. And again, the only person you can control is you in this theory. That's the big thing. You are in charge of you. Everything we ever do is by choice. Reality therapy. Reality therapy. So what do you do as a therapist? You kind of get the idea. You're often seen as a mentoring therapist. You're a teacher and an advocate on the client's side. I'm like the teacher and the client is the student. You teach your clients how to engage in self-evaluation, and you operate on the assumption that people are ready to change. Questions you may ask them would be, how would you most like to change your life? What do you want in your life that you're not getting? What would you have in your life if you were to change? And what do you have to do now to make the changes happen? If we are a therapist, a reality therapist, it is our job to convey there is hope no matter how bad things are, and that there is action on the present. We can take action on these present issues right now. And so you see how it's different than a lot of the theories we've already talked about. So how do you do this? How do you practice reality therapy? We just talked about what is it like for you as a therapist? What type of questions would you ask? But what does the actual practice of reality therapy look like? You're definitely first making sure that you stay in the present as much as possible. Don't let your client get sidetracked. The emphasis is on action. Um, when clients change what they're doing, they often change how they're feeling and thinking. So he's talking about changing that behavior first. And a common question would be, is what you're choosing to do bringing you closer to people you want to be closer to right now? Is what you are doing getting you closer to a new person if you're presently disconnected from everyone? These questions are part of what we call the self-evaluation process, which is the cornerstone of reality therapy. There's urgency. Time's important. This is today. We're going to start today. It's a supportive relationship between the two, like we talked about. Trust is crucial. Um, you have to still have those Rogerian qualities as the therapist, warmth, sincerity, authenticity, etc. So, in this practice of reality therapy, it's best discussed as the cycle of counseling. There are two parts to it: one, creating the counseling environment, and two, implementing specific procedures that lead to changes in behavior. The art is weaving number one and two together, the counseling environment and the procedures that lead to a change in behavior. As a therapist is weaving the two together, you are exploring that total behavior. Remember the term from the beginning of the chapter, that picture album, and evaluate how effective are they in getting what they want. What is that ideal life? What is that Shangri-La? What is that? And how close are they to that? And what is holding them back? You're mildly confrontational, but caring. So if this is your personality, you might like this one. I have a large number of students who constantly like this theory, and there are a lot of great things in reality. You want to take the mystery out. What does the client want to achieve? So another one of these that we're taking the mystery out. These newer therapies like with behavior CBT, and it's not a mystery. I'm going to teach you how to do this so you can do it, right? It's not the secret. Um, I'm not the expert kind of thing. And so then Webolding also, um, he developed the WDEP system. And that's what we're going to talk about next. Formula for what this is part of this process, this practice. This is part of this practice. So we would explain this formula, explore the wants, needs, perceptions, possible things the client can do, direction in doing. So you see WDEP. This is great PowerPoint I did back in the day, and I gave you red letters there. Isn't it nice? Opportunities for self-evaluation, self-eval, and design plans for improvement planning. That is kind of the formula for what you're doing in your therapy sessions as a reality therapist if you're following the WDEP model, I don't know what the WDEP model. Coaching, managing, supervising, parenting, and highlighting issues throughout the cycle of counseling. There are several different ways that you can do that, and that is kind of the crux of it. And let's go through each one and how you would actually do it. W is exploring wants, needs, and perceptions. So the WDEP, this is the W. What do you want? You're exploring that picture of a quality world. What do you want from family, friends, and work? If you were the person you wish you were, what kind of person would that be? What would you be doing if you were living the life you want? What do you think stops you from making those changes? And how do you look at the situation? Where do you see your controls? These are the questions. This is your assessment where you're finding out this data to help your client. And then direction and doing. Is this a desirable direction for the client to be going? How do they see themselves in the future? Taking action in the doing stage, doing it right now. Remember, let's do it right now. We're in the present. What's the holdup? And then artful questioning to help the client self-evaluate, asking clients to evaluate behavior. Is what you're doing helping or hurting you? Is your behavior working for you? Is what you want realistic? Does it help you to look at it that way? So really powerful questions when you think about it. Planning and action. What is the plan to carry this out? Use the acronym SAMIC, SAMIC. What is this? You should know because it's like a SMART goal. So look on page 3, top of 325, the acronym. It's simple, attainable, measurable, immediate, involved, and controlled, basically a SMART goal. Clients gain more effective control over their lives with plans that have the following characteristics, and gives you a list of the way that plans would be most effective. Good plans are simple, easy to understand. There's a course of action. It's measurable. It's effective. It's realistic. All these things that we talked about when we did our wellness plans. So just just be thinking about it. Make sure you know everything about the WDEP system and going through this whole chapter and SAMIC. Through this process, you should start to see change. Work with the client resistant in regard to their own behavior. So that would you would call them out basically on that. How is that behavior helping you get where you want to go? So you say that in a way that's not off-putting when you say it like that. You look for and define the wants of the clients in the WDEP model, and you explore how to make better choices. Change occurs, Glasser said, when clients are convinced that their present behavior is not getting them what they want. When they believe they can choose other behaviors that will get them closer to what they want, they will start to make those choices. There are certain techniques and procedures that are akin to reality therapy, and here is a list. Okay, here's an example with my 6-year-old son. You ready? So you say you stole some candy, and you have a problem stealing candy out of the cupboard?
I had surgery on my teeth.
Because of your candy eating? Okay. So what does that behavior do for you?
It would also make me go a little bit too crazy.
Oh yeah?
And then I would also get in trouble when my family saw me that I was sneaking candy.
So, but that didn't tell me what does it get you when you sneak candy? What's the good thing that happens when you sneak candy? You don't know? What's good about sneaking candy?
Is that you get a little bit of sweet and it tastes good.
Okay, and do you want to keep sneaking candy?
No, ma'am.
Okay, how are you going to not sneak candy in the future? What are you going to do?
So, permission is I can have some candy.
Tell permission if you can have some candy?
Do
you feel better now?
Yes, ma'am.
Okay, good. All right, you can go on out. Thank you for your assistance.
Okay.
I don't know if that's really what we're going for with reality therapy, but it was a start. I figured my interruption might as well bring you a smile, so that was was my fun. So let's talk about these techniques and procedures. In this technique and theory, one of the things, remember we talked about that cycle of counseling, that's the two components of creating the environment and implementing those procedures that lead to change. That's what that is. But then think about what is the counseling environment? Well, you are not going to fight with your client. You're going to be an ally and have rapport. You're not going to argue or attack or boss around. Um, you're caring and accepting and non-coercive. It is mildly confrontational, but always caring. Um, in that kind of coercion-free environment, the client may feel free. Oh my gosh, the kitten just climbed up my bare back with its claws. I almost got through this lecture without getting interrupted. So, as a therapist, you would be attending and listening to the client, no judgment. You might do the unexpected. You might get really creative with what is occurring in the room. Use humor appropriately. Facilitate self-disclosure. Always listening for client metaphors in all therapies, just about listening for themes, summarizing and focusing in, functioning as an ethical practitioner, and make a fair, firm, friendly, and trusting environment. There is another reality therapy video. It says video. We're going to check that link for you on a pod. Well, the good news is this link works. Copy it into your browser and just load it, and it will come up. It's a 9-minute video of reality therapy in action. Almost all the PowerPoints have a link to the therapy usually. If I know Albert Ellis's interview I need to upload for you guys, but otherwise you should be getting those and looking at them. But there are some shortcomings from a diversity perspective. So let's just talk about the strengths and weaknesses of this. I think I started with shortcomings, but let's talk about strengths. This can be applied cross-culturally because these principles are really universal. And Webolding states that makes it applicable to everyone, that we all have those same 5 needs. Remember, fun and all the different 5 needs, the 5 needs that we started with. here they are, the survival, love and belongingness, power, freedom, fun, that we all have that. So that's a universal phenomenon. So this could be applicable to all cultures, um, but would need to be applied obviously in the right way. Um, Golding does say that in applying this to different cultures, you would need to make some changes. For instance, in Japanese culture, assertive language isn't appropriate between a child or a parent and a parent or an employee and a supervisor. Ways of communication are more indirect. To ask a Japanese client what they want may seem harsh and intrusive. That means you need to make adaptations when you're practicing reality therapy relative to Japanese clients. Obviously, there's major shortcomings from a diversity perspective as well. It doesn't take into account institutional racism, social justice issues, discrimination, racism, sexism, homophobia, heterosexism, ageism, social injustice. It doesn't take into effect all of the systemic issues that are going on with people. It is important that you acknowledge that the forms of discrimination and oppression. Also, reality therapists, and they may come on too strong and too authoritative, forcing people that have been oppressed and discriminated against feel like they don't feel like they don't have choices. They did certainly have not had choices, and they may not have a choice. They may have fewer choices available to them, so it can be problematic in those areas.